things on Facebook Live. All right, everybody, we're live. Hello, happy Friday to everyone, and thank you for coming out. I'm here with Allison today, and so happy to have her with me. We're going to have a really important conversation today about dental care and how important it is. So the first thing that I'm going to do is introduce you, Allison, and then I'm going to start asking you a bunch of questions. So here we go. So first of all, everyone, Allison was born and raised in Nanaimo, BC, graduating from a local high school, Wellington Secondary, in 2005. After graduation, she enrolled in a program with a focus on psychology and sociology through Vancouver Island University, formerly known as Malasapina University. I also went there, by the way, where she graduated with a Bachelor of Arts degree in 2010. I don't want to say what year that I graduated. It was a few years before that. During her university years, Allison volunteered with the local women's shelter in downtown Nanaimo, as well as for the Legal Education and Action Fund, also known as LEAF. After graduation, Allison spent a number of years working and traveling abroad in Europe, Asia, and Australia before choosing to focus on a career in the dental field. Allison completed her dental hygiene diploma out of the Canadian National Institute of Health in Ottawa. I know a little bit about Ottawa as well, before once again returning home to the island, which I think is a very smart choice. Before choosing to settle in the Comox Valley, Allison worked in various dental offices between Ladysmith and Campbell River areas during her time with the West Rock Dental Temps. Allison made the move from Nanaimo to the Comox Valley in 2018 and has considered the valley to be home ever since. Currently, she is working out of Courtney Dental Health and Implant Center, where she has been an avid team member since December of 2018. Courtney Dental Health is a family-based private practice with a strong focus on quality of patient care. Their specialties include cosmetic dentistry, clear, correct orthodontics, implants, and non-invasive periodontal therapy. If I say things wrong, you can interrupt me. In her spare time, Allison enjoys singing, listening to music, camping, yoga, and spending time at the beach with family and friends. She is passionate about education and holistic health. I'm so grateful that you're here today. Thank you so much for joining me. I really appreciate it.
Thank you for inviting me. Lovely to be here.
Good. I'm so glad. So the first question that we have for you today is, what drew you to your profession as a dental hygienist?
Honestly, just wanting to make a difference in people's lives, however small. Just have a meaningful work life and feel like I'm contributing in some small way back to society. Um, yeah, it sounds super probably cliche and corny, but yeah, I wanted to have a job that was meaningful, and I felt good going to work every day and doing that.
Thank you. So, a couple months ago, I sent out a mailer on dental care to the riding. And every time I talk about dental care, I always get a lot of response, but this response was amazing. I remember not too long after it landed on the doorstep, I was walking into work and there was a elderly man waiting on the front door of my office, and he had one in his hand, and he just passed it to me and said, "Thank you for asking this question. I'm retired. I have a good retirement, and I have health benefits that followed me into retirement, and I still can't afford to get the dental care that I need." So we have received hundreds of responses, and we're still receiving them. We mailed that out a couple of months ago. We are still receiving responses to today. Today was the most recent one. And one of the most startling things for me is how many people have not seen the dentist in 5 or more years. Some of the responses were literally as long as 20 years. They have not been in a dentist office for 20 years. And again, they just said the reason is we can't afford it. And I just feel so worried about people's health because that is a part of your body. Can you just tell us what is the long-term health impacts if people cannot go to the dentist on at least a semi-regular basis?
For sure. And that's a really tough thing because we see that a lot. in the dental office. We've definitely had patients that have not been in for anywhere from 2, 5, 10, 20, even 30 years and that kind of thing. So we see it a lot. I'm going to go to my notes just here because I did write down a few things because I knew it would slip out of my head in the moment. But just, I was going to say, and this list is definitely not inclusive. There are many other things, but there's a huge connection with overall health, systemic health. So poor dental health is linked with conditions such as diabetes, heart disease, respiratory diseases, lung conditions, even pancreatic and kidney diseases, bowel cancers, Alzheimer's disease potentially, as well as a lot of autoimmune conditions. Literally more than 90% of systemic diseases have oral health manifestations. We can also detect oral cancers that would otherwise potentially go undetected. In the dental chair, we can also see systemic or intraoral manifestations of other systemic cancers in the mouth that could be seen in the dental chair that otherwise might go undetected. The progression of periodontal disease without adequate care can also increase root exposure. People can end up with very sensitive, very painful teeth, ultimately lose teeth. Another fact that a lot of people don't know is expectant mothers that have periodontal disease are more likely to deliver low weight and premature babies. So that's a huge concern as well. A lot of expectant mothers don't know this information. And then there's even connections between your dental health and we can detect things such as like sleep apnea. Sleep apnea could potentially lead to attention deficit disorders. So that's something that can be caught in the dental chair. And then there's like the obvious like tooth abscesses or infections, bad breath, loss of self-confidence, poor nutrition, so many things. Like that is literally like such a massive question, that one alone. But it's very, very important. It is definitely a part of total body health, and it's upsetting that it's been left out for so long, and it's literally like the only part of the body that is not addressed in the same way.
No, it is true. And I think, you know, one of the things as Canadians we're proud of is that if we get hurt physically, except for when it's in our mouth, we can go and get the help we need, and it's there for us, and nobody questions that. And then what we see is this one part of the body that's just completely left out of the conversation, and it has huge ramifications. So you said in there, periodontal. I think I said it right. Can you just tell everybody what that is? Because I think I know, but I just want to make sure everybody else does.
Yes, for sure. And you get caught up talking dental lingo all day long, and then you forget to clarify. So periodontal health or lack of health is disease that affects your gums and the bone surrounding your teeth, essentially. So gingivitis is inflammation of the gums, and that in turn can lead to bone loss around the teeth. And then with the bone loss, you get tooth loss and so on.
It just goes from there. So speaking of that part, you know, about being able to go to the doctor, get your bone set or whatever done, and just not having to worry about the expenses. And today we're not talking about pharmacare, which is a whole other issue, so I won't go there, but I do think it's important to mention the fact that people can walk out of the hospital, be getting all the medication they need, leave, and then not be able to get it at all because they can't afford it, which is another discussion for another day. But what we hear from folks, and what I read in so many of those mailers to me, was that people were making the decision to just go to the hospital and get teeth pulled. They couldn't afford to go to the dentist. They had serious conditions that were causing them a lot of pain, and they just had no other choice financially. And even setting up those appointments, sometimes they had to live in pretty bad pain for a long period of time just because it took them a long time to actually get in to get a tooth pulled. I'm just wondering if you could talk about why this is not necessarily the best way to deal with your dental care.
There's definitely a number of reasons. First of all, having a tooth extracted because it's the least expensive option, or it seems like the only option at the time, can lead to shifting of adjacent teeth, and then you can have difficulties eating down the road. You could have poor nutrition. You could have jaw problems, pain in your jaw. It can, like, if you lose too many teeth, it can essentially collapse the structure of your face, and you lose confidence there. Not to mention tooth replacement options such as like dentures or implants are very expensive, sometimes even much more expensive than maintaining your natural teeth, and they're not as structurally sound. So it's actually less expensive to use preventative care rather than treat things after the fact. It's usually more drastic and more expensive later on. And then as well in the hospital, you know, that OR time is really, really precious. So you could be taking that time in the operating room away from some other surgery as well. That's also very important.
Yeah. Well, what an impossible choice. And I really have compassion for folks who are put in those situations. And, you know, I hear it a lot, people making hard decisions between being able to afford basic necessities and then these things that are really basic necessities. But how do you choose between fixing your teeth and feeding your child? Like it's a terrible decision, and this is very concerning for me. And I think the other part of this that we don't talk about enough is when people have a physical illness, what does that mean in terms of their ability to go to work? To like, I've heard businesses say
Mhm.
to me, like, yes, pharmacare, yes, dental care, yes, childcare, because they have seen the ramifications of that if we don't have those services out there. And another thing that I've seen and I really believe is important and should be recognized is many dental health care professionals are doing their best to help people that are low income, and a lack of dental insurance that folks have, they're still trying to find ways to help people get their dental work done. I know, you know, I'm here in Campbell River today, and we've seen, you know, long lineups where dentists from multiple dental businesses in the community coming together one day a year to provide basic dental care for people who just have no other alternative, volunteering their time, their resources. And I really appreciate that. And I remember talking to one of the front people there that was receiving the intakes, and they were just like, there's so many people that we've had to turn away today. So I'm just wondering if you can tell us about examples from your own personal experience of what dentistry professionals are trying to do to support people who just cannot afford to get the support that they need to do the dental care.
hmm Well, I mean, we do what we can, but it's obviously not enough. There's a huge need. Um, I can say we give breakdowns all the time before people come in for treatment. As awful as that sounds, they have to break it down over the phone, and they may have to choose, you know, one option over another option. Potentially, if one is less costly, even if, you know, the alternative is the one we want to recommend, which is really, really tough as a provider, because of course we want to maintain the utmost standard in care, and we want to recommend the best option for your patient. And morally, ethically, we have to do so. But then our hands become tied when it's a financial issue. And yeah, we don't, you know, people have to choose between groceries or hydro or rent and getting that tooth pulled or root canals. So it is definitely a reality. Some of those programs, there's not enough, but great ones like you were talking about. There is the Gift from the Heart. That's a nonprofit charity that people can donate to, and they help to do these free dental clinics. There's also 2 emergency dental clinics on the island, one in Nanaimo and one in Victoria, but they're only emergencies only, not any kind of preventative dental care. So that's really needed. A lot of universities and like colleges will have subsidized care too, to have practicing hygienists and practicing dentists provide treatment there, which can be a lower priced option. But at the end of the day, there's not enough. I'd love to be more positive on the subject, but it's a huge need, and more needs to be done.
Yeah, I couldn't agree with you more. And definitely hearing all those responses from people, I really feel that this is way more urgent than many people may even know. And you talked about a little bit in your last answer, but just that part of having people call, having people come and get a check up, and then finding out that they have to get some significant dental work done, and then you have to price it out and help them figure out how they're going to afford this over sometimes a period of time. I'm just wondering about the impacts that that has on the people that do this work, who want to do everything but are limited in their ability, and how that, for me, that would be stressful. I know for myself in my role, when I can't help someone, it can sometimes be extremely stressful to just not have that magic wand in my hand. So I'm just wondering, what's the impact on you and the people that you work with?
It's very tough. It can be very emotional. It can be very draining. And yeah, you feel so restricted, and like your hands are tied. But you can't, we can't just, like, as much as I would love to be like, I'm going to give you a free cleaning today. I can't do that, because then I would have to do it for everyone. And obviously I can't do that for everyone. So it's, yeah, it's really tough. And to still provide that quality of care, and not fall into a supervised neglect role as well. It's quite complicated, and we all do our best, but it's not perfect, for sure.
What do you mean by supervised neglect?
Well, if someone came in and they couldn't afford all the x-rays they needed, then we can't do our job to our best ability. Essentially, we can't see what's fully going on. We can't fully diagnose. We cannot fully assess. And then we don't know if we're making the right decision in our treatment plan. There can be things we're missing. There could be abscess. There could be a deep pocket. We don't know for sure. It's like if you went to a mechanic or something and you said, "Oh, my car's not working, but please, don't look under the hood." It's, yeah.
How do you fix it?
Blind, right? Like yeah. So it's it gets complicated, for sure.
Yeah. So one of our MPs, Jack Harris, recently tabled a motion in the House of Commons on dental care. And the plan that he is presenting has been completely costed by the Parliamentary Budget Officer, but it would benefit about 6.7 million people in Canada whose household income is less than 90,000 a year. And what it would do is take some resources and provide access to dental care for those folks. Having resources support folks making less than $90,000 a year in their household, do you think that if there was more supports for you to provide services to those folks, would that make your job easier?
Yes, very much so. Easier, less stressful, more positive outcomes for everyone. Of course, yes, absolutely.
It's been really interesting when he brought it forward, and we've talked about it before. Trying to get the Liberals to change their budget around a little bit more so that we could see that service provided. But again, the engagement has been absolutely profound. I think, I remember when we had somebody in our team with the NDP say, we really need to talk about dental care. And I was like, yeah, like it's important, but I was a little bit skeptical, I have to admit. And then when we actually started doing it, I was like blown away by how important it was to people. And I know, like, I've worked before this, of course, I worked with a nonprofit. And I remember working with other nonprofits in our area around, fundraising for people to get their teeth fixed, really essential things for people. So it's not that I didn't know, but it was amazing to me just how many people just don't have access. So thank you for that feedback. That's really important. Um, a lack of dental care has a huge impact on people's physical health. And I think you outlined that so well in your earlier question, but it also has a really big impact on people's mental health. If you have no teeth or really problematic teeth, it can really block people's ability to get a job, make them self-conscious. I think of one woman who spoke to me and she kept holding her hand in front of her mouth because she didn't want me to see her teeth that were rotting because she was so embarrassed. And she was trying to talk to me and hiding. And I was thinking to myself, like, can you imagine living your whole life trying to hide your teeth? How do you get out of that? So I guess my question to you is, in the work that you do, can you talk to us a bit about the mental health impacts and often the economic impacts of not being able to afford basic dental care?
Mhm. For sure. Yeah, they're definitely tied for sure. Um, yeah, if you're hiding your smile, you lack that confidence, you might not be able to go out and nail that job interview, and get that job that you're striving for, which would be financially. Then you'd be able to support yourself, potentially contribute to the community, as opposed to be on a social program or disability. Um, it also, could block your like your day-to-day like communications, like your social networks, your ability to access services confidently, even meet, a partner. So many things. So socially, you might become more isolated. um, and we're social beings, so that's not great. I was gonna say, we see so many people that avoid coming in for dental care for many, many years, and things just perpetuate. They get worse and worse, and then they get more and more afraid of coming in, and then it becomes even more costly in the dental office because it's so many years and so of neglect built up over time. So then at the end of the day, it's more expensive to them. If they end up in emergency, that's also super costly for our healthcare system. And just like seeing people and their shame. Like I get so many people come in and they are literally apologizing for the state of their mouth, and they'll be in there and they'll be so embarrassed and just, yeah, just continually apologizing that, things are the way they are, but they just couldn't afford to come in. And it's so heartbreaking. And I just like try and, assure them or tell them that like it doesn't matter to me. I'm absolutely non-judgmental. We're here to take care of them. We're dealing with the here and now, and we'll do everything we can moving forward. But it's very heartbreaking to see. And yeah, I wish people wouldn't or didn't have to wait so long.
Yeah. No, it's hard. And even reading the mailers that I've gotten with, seniors saying, I just can't afford it. Or, one senior sent me a note and she said, I budget to get my teeth cleaned once a year. And this last time that I went in, they said that I have to get some more dental work done that is going to cost me $500. I don't know how I'm going to spend, like, where am I going to get that $500 from? And, for some people, $500, it never feels fun to spend $500, but you can do it. But there are so many people in our community who just can't. They can't. And so then what happens? It means they hide it because they're embarrassed. And then, like you said, they walk in the door asking for help and they're embarrassed. And that, I don't think anyone who provides a care for people in whatever, if it's healthcare, dental care, or anything, want people to feel ashamed of something that they really don't have the power to control. So Yeah, it's hard.
Mhm.
Well, thank you for sharing all of those stories. And, for me, I'm going to continue to fight this fight just because it means a lot to people. And I think when your basic health issues cannot be dealt with, it's just not fair. And we need to do better. It's about making decisions. So now I get to end with a little bit of a funner question.
Yes.
I think that it's important with these very meaningful conversations that we also remember that we are all human and that we're all working to a better world where people feel happier and more content. And thank you for being a part of that journey with me. So here's my fun 3 questions. The first one is, what is your favorite beverage?
I know it's a tea talk, and I have some tea here. But it's
I do
not
too.
not awesome. It's not my favorite. I prefer coffee, so yeah.
That's okay. It's Rachel's tea talks because everybody knows my favorite is tea. But you are not required to have a favorite that is just, I understand. I know one of my guests said water, and I was like, that's a good choice, actually. I really like that. So, do you have a favorite book or movie?
Um, that's tough. I was gonna say. I can't think of any favorite book that comes to mind right now. I love reading. I love a lot of books. And I'm currently reading Great Expectations. So we'll see if that one's worth the hype. It probably is. But I don't know yet because I'm only a few pages in. I really liked, growing up, I really liked Kit Pearson.
Mhm.
She was a local author. And a lot of her stories were set in like Victoria and Vancouver. And growing up, I just absolutely adored her books. So yeah.
Yeah, I love it. I've read some books by Canadian authors that are in places that I've either lived or visited. And I think that's so cool when they describe what they're doing and you're like, I have been there. So I think that's fantastic. Eden Robinson, I grew up in northern BC and all of her Trickster series is based in Terrace where I was born and Kitimat. And I just absolutely love reading it because I know the area so well. My last question for you today is, why do you love the place you live?
Oh, I love the community. I think there's so many small local businesses here that are, so many people are just so passionate about what they do, and it's really exciting. I think it's a very special community. I love the little different hubs like the Courtney and the Comox and the Cumberland areas. They're all like really distinct and unique and special. And then I, of course, love the ocean and the mountains and the trails, and we just live in such a beautiful, beautiful backyard. We're so lucky to live here.
We are really lucky. It was funny. I had someone before COVID come to the island, and I didn't get to see them that time, but they sent me a message, and they were from the other part of Canada on the eastern side, and they were like, "I'm on an island, but you have these huge mountains. Like, what is going on?" And I was like, "What did you think this place was?" But anyways, I couldn't agree more. It is a beautiful place to live. The people are amazing, and I really appreciate how much they care for one another. So that's important to me. So thank you for doing this with me. I really appreciate having this conversation. I will be having more conversations about dental care. We're actually going to have Don Davies, who's our spokesperson on health for the NDP, and we're going to be doing a town hall on the 19th of May at 7 p.m. So if anybody's interested, just go to my website, rachelblaney.ndp.ca/dental care, and you can register, and hopefully we'll have lots of people show up so that we can have further conversations about how important this issue is. So thank you, Allison. Thank you for taking the time in your busy life to talk with all of our constituents about what it is to care for your teeth and how important that is as a service.
Thank you so much, Rachel.
All right. Take care, everyone. And I will see you next week where I think we're going to be talking a little bit about gardening. Bye, everyone.